This is a Brigham and Women's Faulkner Hospital Food and Nutrition Department in service on enteral nutrition support, which is also called tube feeding. What is tube feedings? Tube feedings are a way to provide nutrition to patients who cannot or will not eat or drink enough to keep their body healthy. Tube feedings can be used short-term or long-term depending on how long the patient requires it. Here are some reasons why a patient may need a tube feeding. They may have trouble swallowing, which is also called dysphagia. They may not be able to eat because of cognitive problems. They may need more calories than they're able to eat. Like for example, when a patient has a burn or trauma or a hypermetabolic state, they need a lot more calories than they may be able to even eat. They may also have a medical problem where part of their digestive tract doesn't work, so they need to be fed a different way. And sometimes the patient is comatose or unconscious and cannot eat and therefore needs a tube feeding. How tube feedings are administered. Tube feedings can be fed through a small tube and into either the stomach or a part of the small intestine. The tube can be placed in the patient's nose or mouth, or if the patient needs a tube feed for a long time, this tube will be surgically placed into the stomach or small intestine. So here is a picture illustrating. This is the feeding tube going up to the patient's nose and then down into the stomach. If they're having a problem with their stomach or with reflux or things like that, the tube can actually be put down further into their small intestine to prevent any of those problems from happening. And then this is a picture of the surgically inserted tube that goes through their skin and right into their stomach. And that tube can also be extended down into the small intestine if they need that. So there are different tube feed products available for different nutrition needs, and at Brigham and Women's Faulkner we like to use the 1 liter bottles, which is called a closed system, that reduces the risk of contamination because the nurse can just hang the bottle and connect the tubing right to the bottle, doesn't have to pour it into a bag or anything like that. So here we have the products available for tube feedings at Brigham and Women's Faulkner Hospital. The first two products are Jevity 1.2 and Osmolite 1.2. These are both standard formulas that provide the patients with calories, carbohydrate, protein, fat, and vitamins and minerals. Jevity has fiber in it and Osmolite does not, so that's the only real difference between the two. Glucerna 1.2 is a specialized product that helps patients with their blood sugar control. So it's good for patients that have diabetes or have high blood sugars for other reasons like medications or illness. Nepro and Suplena are both formulas for patients that have kidney problems. So they are lower in potassium, phosphorus, and sodium. Nepro is actually higher in protein than Suplena, and Nepro is good for when the patient is on dialysis, whereas Suplena is good for when they are not on dialysis but have kidney problems. And of note, Suplena is the only product we have that does not come in a 1 liter bottle, so it only comes in cans, and the nurses then have to pour it into a bag in order to give it to the patient. Then we have Vital High Protein and Vital AF 1.2. Both of these formulas are easier to digest than the other formulas we have. And so they're good for patients that are having trouble tolerating the formula or having a lot of nausea or diarrhea. Vital High Protein is high in protein, whereas Vital AF is very easy tolerated, good for when they're having a lot of trouble tolerating the formula. And then 2-Cal is a concentrated formula, so where the other ones only have about 1.2 calories per milliliter, 2 cal has 2 calories. So you can give the patient less volume with more calories. So it's good for patients that need to have a fluid restriction or just less volume for whatever reason. One consideration is the order you may see in Health Touch called 2 feed with tray patients. So they would have an order that says 2 feed with tray, and this means that they are getting a tray of food as well as the 2 feed. Sometimes a patient may be eating and also getting a 2 feed. Examples might be if they're trying to wean the patient off of tube feeding and see if they can eat enough to get their needs rather than using the tube feed. Also, the patients we talked about with burns or hypermetabolic needs, they may be able to eat some things but need the tube feed to give them extra supplement to what they're eating. So one thing to think of to give empathetic care to these patients is pretend that you are a patient who cannot swallow and is placed on a tube feed. And think about what it must feel like for you to not be able to eat or drink anything you want and only get your nutrition through the tube feeds. So something to consider when we're giving our patients care.